This tube feeding instruction is divided into 4 sections: preparation, feeding process, cleanup, and precautions. Everything you need: a nutrition balance formula, cup whisk warm water. Add 100 cc warm water. Check how many scoops you need and add the formula. Stir until smooth and fine. Add 250 cl warm water. Stir until smooth and fine. Stir until smooth. Do not use boiling water to prepare the formula. It is best to use water that is warm, but not too hot to touch, to avoid the nutrients loss. Consume the prepared formula as soon as possible. If not consumed right away, or if there are leftovers, cover the cup and store it in the fridge. Use within 24 hours. Everything you need: empty syringe, gastric tube, formula, warm water and towel. Feeding preparation. First, wash your hands with soap and water. Check if the patient needs to be repositioned. Change their diaper or have sputum suction. If necessary, these should be done before tube feeding. Place a towel around the patient's chest. Adjust the bed to 30 to 45 degrees. Position patient's upper body in a semi-recumbent position to prevent gastroesophageal reflux disease. Check the position of the nasogastric tube to ensure it is not dislocated, slipped out, dislodged, or tangled in the mouth. Pre-check. Check the patient's gastric emptying. Fold the nasogastric tube. Attach a syringe to the feeding tube and draw out the contents. Observe the stomach contents. If the aspirated amount is less than 100 cc or less than half of the previous meal, return it to the stomach and start the feeding. Aspirated material should be water, light or diary square. If the aspirated material is dark green, dark red, blood-stained or brown, do not proceed with feeding, and seek medical attention immediately. Bend the gastric tube back. Remove the inner tube from the empty syringe. Pour in 20-30 cl warm water. Then, unfold the folded section and moisten the nasal cavity. Pour in the formula. When the formula is nearly finished, fold back the tube again, pour in more formula, and repeat this process until the formula is completely empty. During the feeding process, if the patient experiences coughing, vomiting, or face turns an unnatural shade of purple, immediately stop the feeding and seek medical attention right away. Pour in 20-30 ml warm water. Open the folded place and clean the inside of the tube to prevent food residue. Seal the nasogastric tube. Continue to keep a semi-recumbent position for at least 30 minutes. Avoid vigorous activities such as suctioning, back patting, repositioning, rehabilitation, and mucolytics for 1 hour. Thoroughly clean the feeding equipment and dry it to prevent food residue and avoid bacterial. The tape that secures the gastric tube should be changed daily to keep the area clean. Ensure that the depth of the tube cannot be moved. Apply the tape to different areas. To prevent skin breakdown, patients should receive oral cleaning and nasal care multiple times a day. Food and medication should be separated by at least 30 minutes.